Good Day Columbus on Fox 28.
If you suffer from allergies, well, you are in luck this morning.
We have the guy here that you need to know. Dr. Shah, the founder of Premier Allergy and Asthma, joining us this morning to try to give you some relief. First and foremost, good morning.
Good morning.
And you are the person that everyone's running to right now.
Yeah, this is, especially in Ohio, this is the time of the year when it gets pretty miserable for the allergy sufferers.
We're blessed, right?
Oh, yeah, absolutely. All right, so what do we need to do to know to get some relief?
So, most times when people have allergies, it's for a short period of time. So the over-the-counter medications work great. You go into the local pharmacy, pick up some over-the-counter antihistamines, or, if your symptoms last for a significant amount of time, you can do like a nasal spray that can be prescribed by your primary care doctor or over-the-counter. And usually for most patients, that's good enough. What we see a lot is the patients that are not getting relief with those over-the-counter medications. That's when they get referred to our practice. See a board-certified allergist. And the first thing that we do after taking a thorough history is do what's called allergy testing. I'm sure you guys have heard of that.
Yes, absolutely.
When we were younger, the horror stories were the needles and the scratches and stuff like that. That technology has progressed now a long way. So now you can get tested. It's painless. There's no blood. There's no needles. And we find out.
I didn't know that.
Yeah, exactly. And then we find out what you're allergic to.
Okay.
Once we find out what you're allergic to, then we can kind of come up with a more customized treatment approach to taking care of your allergies.
Oh.
And for people who maybe haven't experienced allergies yet for whatever reason and are just now starting to get them, what are the early signs so where you can jump on it to take some of these things over the counter so you're not just completely miserable?
Yeah, great question. So, the couple of things that we see right off the bat is itchy, watery eyes, nasal congestion, sneezing, coughing, sore throat, but then there can be some atypical signs of allergies too, like headaches, recurrent sinus infections, ear pressure. So, anything in those upper airways is going to really cause, that misery right now.
Ear pressure.
There you go. See, now you've got allergies.
Learning all
right, Dr. Shah, you brought some vials here. What is this?
Yeah. So, we talked about earlier about allergy testing. So one of the things that's remarkable is in allergy, we can offer what's called allergy immunotherapy or allergy shots. So once we find out what someone's allergic to and they're not getting better with the typical medicines, we can put them on a program where we take the very things that they're allergic to, put them into liquid form, and then dilute them down to a very low concentration. And then patients come every week to get a small shot in the back of the arm of the very things that they're allergic to, and we build up their immunity, so then after a while, they're no longer allergic to the things that they were allergic to. So it's wonderful. I mean, it's been around for over 100 years. Every insurance company covers it, and we have patients that are, the next season they come back and they just are like, wow, it's amazing.
So like we need that special solution. Jab me with that special magic potion. So just one last question for you quickly. The weather has been all over the place. This is what we typically expect in Ohio. Have you noticed a difference this year in the amount of patients you're seeing?
Yeah, so we are the busiest that we've ever been, unfortunately, because we had a little bit of a late start to the spring. It was wet, it was a little bit cooler if you noticed, like in March or April, but now the trees and the grasses that are starting to pollinate, they still are releasing the same number of pollen, but it's just over a shorter period of time. So I think this year we're seeing, it sounds like I say it every year, but this year we're seeing worsening symptoms than last year. Yeah,
we just keep progressing. Keep progressing.
All right, Dr. Shah, thanks so much for joining us this morning. We appreciate it.
Yeah,
Caroline?